think that's why it's so famous in India too, the homeopathy, because before I studied about it, I thought it was from India. But what is homeopathy? Hi everyone, welcome to WhiteSwan by Shalini. Today we're going to be diving into the fascinating world of homeopathy with a very special guest who is all about holistic healing, especially when it comes to your little ones. Whether you're looking for a natural remedy or an alternative to modern medicine, you're in for a treat. Our guest today is a well-renowned homeopathic doctor who has years of experience in treating families and kids. She is the founder and director of Homeopathic Health Center in Singapore. She is also the founder of the International Institute of Homeopathy and the Immunity Company. So without further ado, let's welcome Dr. Rukshin Master.
Hi.
Hi, doctor. So happy to have you here.
Oh, I'm so happy to be here and share my journey with y'all and your audience today.
Great. So could you tell us, how did you choose to become a homeopathic doctor?
Sure. So my journey was actually something that started all the way from the family I was born in. So as a lot of people are aware of, my father is also a homeopath. So I am a second generation homeopathic doctor. Ooh. And he's rather famous. He is a professor and teacher in almost every university internationally. He's been a professor in the same college that I graduated from as well. He's written more than 40 to 50 books, and he's done a lot of pioneering work in the field of homeopathy. Oh, wow. So it was the family I kind of was born into and exposed to right from the time that I was a child. And for me, growing up, I think medicine or getting treated for any ailment was only homeopathy. I wasn't even aware of another system back then. So growing up, I had my measles, I had my mumps, every kind of viral infection. Everything was only supported with the help of homeopathy through all of these infections. And for me, actually, that was normal. Now that I know of this whole other side, I'm like, okay, people really find it very fascinating that, how is it possible that you were not exposed to a single other medication? But luckily, that was my story, growing up. And I used to go to my dad's clinic actually all the way from the time that I must have been 10 or 12. My mom used to drop us off every time, she didn't have somebody to take care of us. And so I was exposed to how he was working. That was, of course, very fascinating for a child to see their, father have loads of patients come in, ever thankful, ever grateful for the kind of impact that his medications would have on their life from incurable diseases. And so he works with a lot of cancer and end-stage complaints. And homeopathy has, again, a huge role in that aspect of health as well. And so seeing all of that was, of course, very inspiring. And so it kind of became the direction that I started working towards. And eventually after the 12th, I was like, okay, this is it. This is the only thing that I see as a purpose in life, to kind of educate people, to help people using more gentle measures, which are so readily available in nature. Right. And unfortunately, we don't make the most of them. Mm-hmm. And so that's the journey I kind of started all the way back in 2005. Right. And
you could see no further.
Yes, exactly. I mean, the minute I got into it, I felt like a whole new world opened up for me. Right. I already kind of had a lot of background knowledge around it, which kind of gave me an edge even in college. And of course, having him to kind of tutor me, mentor me.
To be around every time.
Exactly. And so I started off doing my undergrad college. Right. And that was a 6-year program. And then following which I did my MD in pediatrics, which was another 3-year program. And following which I then decided that I want to do some form of research, because I felt like it's so important for us as homeopaths to not tell people that it works, but to actually show the results in a proper scientific manner.
Very true.
Because of which I started working in a pediatric hospital back in Bombay, which had a homeopathic department. Okay. And through that department, I did my research program and got my PhD.
So is that for all the homeopath doctors, that they need to go through a series of studying of medical, right? Like PhD and getting a MD?
So people can stop at the level of BHMS, which is the undergraduate level that I did for 6 years. And our program is actually very unique and only takes place in India. India is luckily only the only countries that has a program that allows you to learn modern medicine along with homeopathy.
Okay.
So a lot of places in the world have homeopathy as a postgraduate training. So you become a conventional doctor and then you take up homeopathy as a postgraduate training. But in India, we are exposed to it all the way from the beginning. So for us, our 6 years was half and half. Half our education was studying anatomy, doing your dissection, studying forensic medicine, surgery, gynecology, internal medicine. We almost have the same curriculum that the MBBS students do, except that we don't learn their drugs and they don't learn ours. Other than that, the foundation of science, the foundation of becoming a doctor remains the same for both of us. And so we get similar graded exams. We have similar questions that come in both our papers. And the only additional thing that we learn is our homeopathic philosophy, our homeopathic remedies, and how to work on all of these diseases, but using homeopathy as a treatment modality.
All right. So it's an extensive study.
It is an extensive study. Yes, it's a 6-year program where we have hospital training, we have internships, we're made to observe surgeries taking place, we're made to observe deliveries happening. So it's a whole all-intensive program where half your day is hospital, half your day is, sitting in classes. It's practical examinations. We learn how to differentiate things under the microscope. It's an all-in-all program, which is why India is the only place where a homeopath is then called a doctor, right? So we get that degree of a doctor only because we are well-rounded, taught in everything.
I think that's why it's so famous in India too, the homeopathy, because before I studied about it, I thought it was from India because it was so well-renowned in India that everybody was like, oh, homeopathy, you have to take homeopathy if this doesn't work. Yes. But what is homeopathy?
Okay, so homeopathy is something that actually came about in Germany. And it's more than a 200-year-old science. It actually was introduced by an allopathic physician at that time called Dr. Samuel Hahnemann. Now, he was a German doctor at that time. At that point of time, medicine was in its very initial stages of, evolving. There was still a lot of crude practices that were happening at that point. For example, it was still a very common use that they would take these leeches and put it on your body, and then the leeches would suck out your blood. And that was very commonly used in, doctors' clinics. What they believed was that when this blood comes out, automatically your toxins and poisons and bacteria are coming out at that point of time. But eventually that would land up actually causing so much more harm and in some cases even killing the patient.
Oh my God.
Another use at that point of time was giving large doses of sulfur, large doses of mercury, large doses of other different metals, which they did not realize at that point of time was actually causing a lot of harm. And so he practiced for a few years and then eventually he was like, this is not what doctors are supposed to be doing, right?
True.
I mean, the first rule that we kind of take in our oath is do no harm. And when you're doing more harm than you're doing good, I mean, he felt like, I don't want to practice medicine anymore. And so there was a point when he actually left practicing. He went into translations of medical books. He went into doing more academic work. And that's when he stumbled across through an experiment, the whole world of homeopathy. And since then, I mean, it blew his mind as to how there was a whole system of medicine that he could evolve from that, which is basically using particles that are present around us in nature, animals, plants, different enzymes, different abstracts, to be able to work in a more natural manner on our body. And so the 3 most important principles, I would say, with homeopathy is number 1, to work with nature and not against nature. So we work with the way our body wants to progress with a disease as compared to trying to suppress everything that the body is trying to tell you. The second thing is to treat a human body as a whole and not have, a cardiologist manage the heart and a pulmonologist manage the lungs and, an internal medicine doctor manage this. We believe that the body functions as a whole. You have to treat one part to be able to affect the other one, to be able to affect the other one. We're not working in different, segregated compartments in our body. And the third principle that we follow is that we always believe that the mind and the body are connected. So homeopathy relies a lot on understanding the mind, even when we're trying to understand any kind of physical complaint. So a lot of importance is given to understanding why this patient got sick, right? So we believe that it all started from that thought. It all started from an emotion that did not find the right resolution. And that is something that, eventually progressed and caused a disease in this person. And so these are the 3 kind of pillars that we rely on when we're treating a patient with homeopathy.
So then when it comes to respiratory problems with kids or even adults also with cough and cold, or pneumonia, or we see a chronic disease with respiratory problem, then don't you just look at the respiratory problem? How do you approach that?
So any case that comes to homeopath is actually taken in a very detailed way. So for example, let's say a kid comes to me with a complaint of asthma.
Right.
Okay. And when that child walks into the room, the whole idea for me is to understand this child top to bottom, every symptom that this child suffers from, and to differentiate this child from all the 1,000,001 cases of asthma that are already existing. So every patient that comes to a homeopath is treated in a completely different way because we're all very unique in our abilities, in our approaches, in our coping mechanisms, in the way our body reacts, right? For example, when a person has asthma,
Right.
there are some kids who will have breathlessness which will be more in the night. But some kids with asthma will have breathlessness more which they have after eating their lunch. Or some kids would develop that same kind of asthma when they go out inside a garden.
Right.
So every child is getting triggered with a different stimuli. So how can you treat every child the same way? How can you
Have a generic
Exactly. How can you have that one size fits all approach for all of the complaints? And so with homeopathy, when that child walks into my cabin, I start off with understanding, of course, how the asthma started, how it progresses, what triggers it, what makes it better, worse, the cough and the cold symptoms along with it, but also understanding the rest of the body. So, for example, if that same child has some gastric issues along with it, I also work on that at the same time. It's not possible for me with a homeopathic remedy to treat one part of the body. Our every cell is connected. It is not possible for you to feel better in one part and feel worse in the other when you're on a homeopathic treatment, because that treatment that I give you affects the whole. It affects the entire energetic system of the body to start that work of repairing itself, to start that work of healing itself. And so any kind of effect is always felt overall. The energy levels improve, the appetite improves, this child becomes more attentive, more focused. Similarly, even with adults, they start feeling so much more zeal and zest in life with the remedy because it has to have that overall effect. And so similarly, when that child comes in, once I do understand all the physical aspects, we also then go into understanding the mental aspects. So what is the personality of this child? How does he, let's say, react to anger? How does he react when somebody shouts at him? How does he respond to his siblings? What is his relationship with his peers at school? What are his fears? What are his anxieties? What does he love to do? What are his hobbies? All of this forms a constitutional picture for us. When I get that constitutional picture and I exactly understand every aspect, including his appetite, what he loves to eat, how he sleeps, where he perspires on, which position is more comfortable for this child, everything is taken into consideration into what I will then prescribe for this child for his treatment.
But doctor, what really actually happens is we usually take up all the modern medicine when we are tired of, it's not affecting us. We're not getting any better. Then we think of another healing process. Okay, should we go for that? And then maybe that can help us. So then we end up going to homeopathy, naturopathy, Ayurveda, anything of that sort. So, but why does it take us so long to understand that, okay, fine, when homeopathy is seeing everything in such a whole way, why doesn't one go for homeopathy first?
So the thing is, I think it's a lot of indoctrination over a period of decades that we've gone through with modern medicine. So what happens is there's a huge faith that we have with our doctors, right? So when a patient, of course, as a mother, you're a first-time mother, you're anxious, your child is sick, you go to your pediatrician at that point of time. And your pediatrician tells you, no, he has to take this, has to take the Panadol, has to take the nebulizer, this child requires this. Otherwise, then that fear comes into the mother's mind. And so eventually what happens is a lot of that trust leads to mothers to believe everything that pediatrician is saying. Now, unfortunately, the pediatrician is not aware because his system of medicine has taught him this much. He does not know what's available outside that system, correct? So it's very important for mothers to do a lot of their own work in learning first what are the different options that are available. And now mothers instinctually feel that, I don't want to put my child on this. I know that this is bad for my child. I know that, this nebulizer is not something that's going to do any good for him. Right. But mothers who know what they're doing, especially when it comes to the second and third child, and they've gone through a bad experience with their first one, that's when they know that, the system is, is good when it needs to be done in those SOS emergency situations. But my first line of treatment should be something that works with my child and not works against it.
Exactly. So when it comes to skin diseases, like you have psoriasis or you have eczema in kids, How do you treat that in homeopathy?
Okay, so now eczema is actually very interesting. Singapore has a huge number of eczema cases. When I came to Singapore and started practicing from Bombay, which was about 5 years ago, I was shocked to see the number of eczema patients that we have out here in comparison to India. And that's when I started digging up a little bit. And the current statistics states that 1 in 5 child out here in Singapore has eczema. 1 in 5.
Oh my God.
And out of that 1 in 5 who has the eczema, 50% of them will go on to have lifelong eczema, which means that they will suffer from that complaint for their entire
life.
And that is so sad to hear.
Exactly.
Because we cannot empathize, sometimes to understand how uncomfortable it is to have that constant itch, constant agitation, constant irritation in our body.
Right.
It doesn't let them sleep. It doesn't let them function. I know of kids who can't focus in school now, have to drop out of school eventually. Allergies can be because of 101 things. It could be because of your environment. It could be because of the food. It could be because you're lacking enzymes. It could be gut related. It could be a dysbiosis of the microbiome. It could be hormone related. It could be excess estrogen. There are 1,001 factors that come into play. Now, when you give an antihistamine, it is very easy to just prescribe generic medicines. But that rarely ever solves the problem. Eventually, this child lands up with steroids. Eventually, steroids also stop working. Then eventually, it's oral steroids and local steroids. And this cycle and story just keeps on progressing. So the only way to deal with it is always root cause. You have to identify the root cause and you have to treat that. You have to treat your body at a very core cellular level. I cannot treat a skin as an organ that's, that's superficial. Just because you can see it, the disease is not here. The disease is completely all over the body. When it comes to any condition, it's not always it's a localized symptom that you see. It's not a localized disease. It's always a systemic disease that you need to work on. So again, similar, the child comes in, I take the symptoms, study the entire constitution. I try to give them a lot of holistic advice. So my treatment normally always involves, doing some supplementation, involves them doing some home remedies. So I'll give them more natural solutions to, kind of subside their itch or, temporarily, help them cope with their day-to-day. Yeah. And then we kind of, over a period of time, land up working on their eczema. And I've seen fabulous results. Fabulous results where, kids come covered sometimes head to toe with that scaling, dryness, peeling off, itching, can't sleep at night. And over the next 2 or 3 months, there is drastic improvement in these cases because no one's ever tried to address that internally. Every time that they apply that little steroid, it subsides. In the next few months, it always comes back worse because you're not working with the body, correct? When the body wants to try to show you something, it wants to tell you that, it's screaming for help with that symptom. Every symptom is a way of the body talking to you. So if the body's talking to you, trying to tell you, that something's wrong inside, fix me, but you simply put a little bit of a cream and, try to get rid of what you can see and not what's inside, the body's going to scream louder because you can never win with nature. Nature's always going to come out superior to you. You work with the body. That's the only way to support it.
Could you give us any example of any of your clients who had come up to you with eczema or let's say something very harsh, skin disease, and then that gave that child a big good result after taking homeopathy?
So loads of cases actually. So this eczema case, for example, I did a follow-up of this child. He came to me maybe about 2 years ago and that I'm working with him. He came to me actually so the mother, of course, as the first mode of treatment had started the child off with taking him to first the pediatrician. The pediatrician refers you to a skin specialist. The skin specialist, you go. Right. Different creams over a period of time, trial and error, nothing really helps. Done a lot of other treatments, like for example now, people want to eliminate foods, right? So she'd done the whole vegan, gluten-free, this free, that free, take out everything from the child's diet, try and see if that helps. Nothing was helping this child, and this child was covered literally head to toe. Honestly, when I saw the child, he was scrawny, super thin, emaciated, because the body was not assimilating any food that this child was eating. Everything was just going towards, just making it day to day at that point of time. The child was not sleeping, doing very badly in school as well. And just over the course of the first 2 or 3 months, we started noticing such good relief with this child. And slowly, part by part, okay, the legs are better. Okay, now the tummy is better. Okay, now, slowly the body started healing layer by layer. And now I'm still supporting the child not for the eczema so much, but just to make sure that the body is still, a little secure and not in a space to go into a relapse, because that is also very important. Sometimes homeopathic remedies even act as a preventative.
Okay.
So I'm using it more for that purpose right now, because we want to make sure that, everything that the body needs is there, and we're not vulnerable to any kind of a relapse at this point of time.
Oh, that's nice.
So there are many such, cases that I have seen through my life with my own practice, in clinic when I used to work with my dad, where sometimes you feel like it's nothing short of a miracle, right? And so when they tell you, oh, homeopathy is a placebo, homeopathy works this way, oh, it doesn't work.
Yes.
When you've seen it in front of you,
Yes.
when you've experienced it, of course, on yourself, and
Yes.
now, with my daughter as well, who's completely on homeopathy for anything that, happens to her, there's no way for you to, believe otherwise.
Right. So homeopathy can be taken as a precautionary medicine?
Yes. So that's another thing that I see a lot of in Singapore, where mothers will come to me, my kid is going to start school now.
Right.
And they've heard all the stories,
Yes.
right? So they know that, the kids are going to be falling sick ever so often.
Yes.
They don't want to take them to the pediatrician. They don't want to go down the route of, just doing the cough syrup and this syrup and that syrup. And so they want something to build up on the immune system.
Yes.
So they're like, I want my child to, kind of be more resilient, be more strong. Can you give us something? And so again, I, study the constitution. We try and see which element is the one that fits best with this child. And we start off the child on that remedy.
So even for adults, like suppose if we're going traveling or somewhere and
Yes.
then we think that, okay, fine, we're in such a hot place in Singapore. But when we go to a cold place, we know ultimately our body will take some time to adjust to that.
Correct.
So even for that, we can take...
Even for that, yes. So sometimes I have patients who are going to Bali and they're like, we don't want to have the Bali belly.
Yes.
Or, we're going to a dengue infected, area and,
yes.
we want to prevent dengue. So
Right.
we have a lot of remedies that we give for those purposes as well, which help you more on a preventative basis. So actually homeopathy since the last 200 years has been used in many epidemics. So at that point of time, 200 years ago, Europe had many epidemics happening, including the scarlet fever, including typhoid, cholera. There used to be these regions where, people would just completely start dropping and dying. And there are many studies done from that time where they, used to have these certain groups where they'd be like, okay, this group is only going to be given homeopathy.
Okay.
And the other group will, get the hospital treatment and the conventional treatment. And every time the homeopathic group would get much better results, much fewer deaths, much faster recovery. And that happened in COVID also.
Oh, wow. I wish
So-
the whole world
Yes.
could know about that.
Yes. So again, for preventative, for, epidemics, homeopathy has been used since centuries.
Great. How about chronic diseases like thyroid? Can it actually make it go away, or can it make it lesser? Like we'd have to take a smaller dose of the thyroid medicine.
Yes. So how I work with any case, whether it's thyroid, whether it's asthma, eczema, what we initially start off with is, similarly, we take the entire case history. I get to know and understand which remedy would work best on you. And the allopathic medication that this child is on or that the adult is on is simultaneously continued to a point where we feel confident. And when I say we, I mean not only me, but I also expect their GP or their specialist to be on board with everything that I'm doing. Because I would always rather be playing in a safe realm when it comes to these conditions. Often what happens is that without me saying anything, when they go for their, routine checkups, automatically the physician is like, okay, you know what, we're doing so much better, let's cut down on this.
Right.
No need for this steroid anymore, or no need for this thyroid medication, or let's say from 100 milligram, we've come down to a 75, to a 50.
25, yeah.
And that eventually just very organically happens over a period of time to a point where we can, in some cases, even cut off the medication completely.
Okay.
And the body is able to support. So now for thyroid, right, what happens? What happens is that the body eventually, when you're giving external hormones,
Yes.
the body stops producing it on its own.
Oh.
And this happens with everything, even when you're dealing with, let's say, your hormonal, like your estrogen, your progesterone, the sex hormones. When contraceptives are given or when any hormone replacement therapy is given, the body stops making it on its own because the body already finds it circulating enough. So the hormones that are responsible to stimulate the glands to produce the hormones eventually stop stimulating them anymore. Over a period of time, we don't want that to happen. We want the body to still, be able to function. In fact, we want to stimulate it to function correctly.
Right.
So instead of giving these synthetic hormones and, that cause a lot of their own side effects in the system, what we want to do is when we understand the constitution, we understand the body's underlying issues, we can then address them. And when we address them, eventually, again, as I said, the medications go down on their own. The body starts making the hormone on its own, and there are many studies done on it. So if you just put up in, like your Google Scholars, show me some research on, thyroid cases or Hashimoto's and homeopathy, it will show you a lot of clinical verified evidence on how homeopathic remedies work and what they've been able to do with thyroid.
So basically what it does is homeopathy helps us to not stop that gland from not secreting those hormones, but help it to work faster or better.
Help it to work more efficient. Correct. So the whole crux of homeopathy is that we want to support the body. Okay. The whole idea is never to replace, to supplement, to do the work for it, but to actually get optimal results from the body itself. Our body is capable of healing,
right?
Okay, which is a very fundamental concept. Our body is capable of performing functions at very good levels.
Yes.
We were born generally pretty healthy into this world from our mother. Very rarely do you see these genetic disorders. They would probably compromise 1% of the cases. The rest, 99% of us come into this world pretty good.
Right.
It's what we're exposed to after that that deteriorates our health. It's what we're given. It's what we're fed. Unfortunately, everything that you're eating now has some of the other pesticides and chemicals and your MSG and your glyphosate and things like that. And so, unfortunately, disease is bound to
which
enter
we can't even avoid.
Correct. Which you can't even avoid. Your environmental toxins is constantly the spraying of pesticides, which you're breathing in, your child's breathing in. You can't, beyond a point, prevent that. So all you have to do is make sure that the body is able to process it and eliminate it. Your detox pathways have to work correctly. Your immune system has to work correctly. When your body identifies an inflammation in a particular part of the body should have adequate supplies to be able to go to that part, release the cells that are required and destroy that inflammation or destroy that infection.
Right.
But often what happens is that sometimes we have inflammation here and here and here and in a million other places, and that's when the body is so overwhelmed, it gives up.
Okay.
So that inflammation is the cornerstone of every and any disease.
Okay.
When that inflammation starts, that's when the body starts, hampering its way into how to deal with that inflammation. Once we can deal with that inflammation, which we can do when we give the homeopathic remedies, it can work for any and every condition. Because again, inflammation is the cornerstone of every and any infection.
So coming now to homeopathy medicines, how is it made and how affordable it is?
So now in India, the standards of homeopathy are very different as compared to what we have in Singapore.
Okay.
In Singapore, I feel like homeopathy is at par economically in terms of, going to a pediatrician or going to your homeopath would probably cost you the same.
Okay.
So hopefully when you go to a homeopath and they're good and they know what they're doing and they have that kind of experience to deal with your complaints, you should be able to get out of that cycle of medications. Your body, once stimulated in the right way, should be able to then do everything that it needs to do. For example, when a patient comes to me with asthma and I can help their body be in the right immunological status to deal with that asthma, that child will then be able to deal with typhoid also. That child will then be able to deal with an autoimmune also. The child will then have the capabilities in them to be able to be stronger for everything. It's not that I'm only working towards dealing with that asthma, right? As I said, we're working on the body. When the body is strong, the body is strong for everything. Then you don't have to go running to this specialist and that specialist and here and there, right? When the body has its own capabilities and it's kind of strengthened itself to that point where it can deal with every inflammation that the body needs to fight against.
What is homeopathy made of? Like, what are the medicines?
So,
how
as
is the
I
medicine
said,
made of?
everything in nature. We work with everything in nature. There are newer and newer medicines coming up in our repertory every single day. There are newer substances introduced. When Hahnemann started at that point of time in his life, he introduced about 100 remedies, but now we have more than 2,000-3,000 remedies. So it's quite extensive, and we use everything that nature has made.
Right.
So whether
Everything
it's
natural.
plants, yes. So he started off with plants. We started off with, different parts of plants. So for some plants, we use their roots. For some, we use the leaves. For some, we use the flowers based on, which part is therapeutic in nature. Then eventually it also started to animals. So we make a lot of our medicines from animal abstracts itself. Like, for example, we use the milk of certain animals. We use enzymes from certain animals. Remedies are made from that. And then now we've also started using minerals. So minerals are a very important source for our remedies as well.
So coming to a little fun part, could you burst some myths around homeopathy?
Oh, okay. Would love to.
So it's said that homeopathy is a slow process. It works slowly. What do you have to say about that?
I think the right answer would be for me to say yes and no to that myth.
Okay.
Sometimes it can seem slow when we are expecting quick results. So when a mother comes to me and tells me, my child has so-and-so complaint let's say we're dealing with adenoids. Now, adenoids is something that we very commonly see with kids. They have that blocked nose, stuffy nose,
Right.
all related to allergies. The child can't sleep at night, snoring, grinding of teeth, things like that. And the mother expects that I give them the same result that a steroid nasal spray gives them, which is that they put it overnight and the next day the child is breathing, correct? So they feel, homeopathy is so slow because it did not give us the result as quickly as we expected it to give us.
Right.
But at the same time, the same mother is going to be using those drops for the next couple of years because there's no way that this child is going to function without those drops. There's no way that those steroids are curing the complaint. So this mother will eventually be on that treatment, but she still feels it works. The same mother who relies on homeopathy for those adenoids and for the allergies, I might be able to take a month or two to show her that relief, but it'll be something that this child is not dependent on. Over the next few months, I can easily taper off the remedies and this child's allergies are cured. So in that case, yes, it will take its time. The body will take as long as it needs. And I think that's the best way for it to go because that's more sustainable. That's more permanent.
So the another myth would be it is a placebo science, homeopathy, like you mentioned before also.
Correct. And which is why research has now busted that entire myth.
Okay.
So there are many research laboratories that are now present all over the world. They're not only doing clinical research, whereby, let's say, practitioners like myself, can submit clinical data to show the way homeopathy is working. But we also have cellular level research. So, microscope, laboratory, they take slides, they take different infections, they put in different potencies of the remedy or different kinds of remedies. And through the microscope, you see, things changing over a period of time. Okay. We have studies showing that. We have a lot of animal studies, which have become a big part of our homeopathy, actually. So they're now homeopaths who are specialized. So they're veterinary homeopaths who do a lot of work with horses and cows and in the zoos and things like that. I don't think that's possible if it's a placebo. Animals don't react to placebo. Kids that I work on, which are as small as 7 days old and 5 days old, do not react to placebos. Microscopes cannot show results based on placebo. So we have more than enough scientific evidence now to show that it's much, much more than what a placebo is. And so generally in the research community, a double-blind clinical study is the best way to show that any kind of treatment works. And there are excellent double-blind clinical studies that have been done that show that, for various conditions, homeopathy is shown beyond par results.
Oh, wow.
And so now it's only, people who want to malign homeopathy would speak that, but those unfortunately are the ones who might not be aware that there's actually, this whole body that's doing excellent work. There are many countries that have taken it on themselves to kind of, go ahead and prove the scope of homeopathy, and they're doing excellent work.
The third one is homeopathy is basically sugar pills and they are not suitable for diabetic patients.
Okay, so now homeopathy, the way that our remedies are prepared, because we take stuff from nature, we have to preserve it. Okay, they're not, made in a laboratory in a way that, they have 5 years of shelf life. So to preserve it, we need alcohol. So alcohol is actually the way that every of our medicines is made initially.
Okay.
Now, from that, what we do is we dispense it in the form of pills, which are these lactose pills or sucrose pills, or we dispense it in the form of water. Now, how I like to dispense my medicines to move around this issue of, milk and sugar and, I don't, like some of the kids are lactose intolerant, mothers don't want sugar going in the child system. So what I do is that I dispense it in the form of pills, but the pills go into water at home.
Okay.
So at home, the mother will take that pill, put it in a glass of water. So it's like one tiny pill going in a glass of water. We stir it, and then the water is what I dispense to my patients is 1 teaspoon, 2 times a day, 3 times a day, based on how much they need it. And so this works around every issue. It works around the issue of having no alcohol in the water that the child's taking, no sugar, and no lactose as well. So it's completely safe from all of that. And there are many methods that have evolved over a period of time for us to be able to, circle around those issues. In fact, I have a lot of diabetic patients who I work with. Homeopathy has an excellent scope with diabetes and for insulin resistance. And we have loads of herbs that we use in the tincture form to work on that. And so, no, that's definitely a myth that, diabetics shouldn't take it. There's a lot of research there to prove otherwise.
And the fourth one is homeopathy cannot be treated along with conventional medicines.
Again, absolutely wrong. Some homeopaths choose to not use homeopathy along with conventional medicine, and so they expect you to stop it. I am not one of those.
Okay.
And I believe a lot of medically trained homeopaths would not be one of those because they're aware of the risks that contains. I know of people who will tell the patient, you have to stop your steroids when you come to me for homeopathy, or you stop, your thyroid medication when you start homeopathy. Absolutely wrong practices. They both work on very different planes. The medication that you are given conventionally, allopathically, works on a very different plane. The homeopathy is working on a very, very different plane. It's working on your energetic plane. So when I am working with your body's internal innate energy, there is nothing that you're doing around it that can affect it. So when people say don't drink coffee and don't have garlic with homeopathy and don't do this and don't do that, none of that is really true in scientific terms. You can do and continue everything that you are already doing.
Yeah. So basically homeopathy is the holistic view of looking at your body.
Correct. So it's the holistic way of looking at your body. It's again working with your body, understanding why everything is happening. We really sometimes feel like we're playing the role of detectives because every time a little symptom comes on, you put on your, Sherlock Holmes glasses and you're like, okay, what is it? Why has this happened? First, understanding why has this happened. Once I feel like we understand that, everything becomes so clear, right? So for example, when a child comes to me and, the mother has issues with the child having a runny nose. Now, for a mother to understand why that's happening, right? So why is that happening? Because this is the fastest way for the body to eliminate that allergen or to eliminate that infection. This is an open orifice that the body has. This is the fastest way the body can get it out. What do? We want to take medications to stop that discharge.
Right.
Now that infection is inside. Now the body has to work harder to eliminate it. But these simple tricks are not taught to parents. They feel like this is bad for my child, right? Like a runny nose is such a bad thing. A cough is such a bad thing. But this is the way the body eliminates. You eat something wrong, you immediately go to the stools and pass diarrhea. This is your body's way of eliminating.
Yes.
But what do we want to do? We want to stop that diarrhea. We want that infection to brew inside and brew inside and brew inside. And so when we're not working with nature, when we're not working with what the body is trying to do, we're always going to land up in some kind of a soup. So we have to understand what's happening.
Right. So considering Olympics now, can sports person take homeopathy and not be considered an enhancement drug, or
yes.
is it?
No, so homeopathy is not considered an enhancement drug. Again, as I said, there is no material dose that we use. It's working on the energetic aspect. So it's completely safe. There is no test which someone can do and, tell you that there is some amount of drug which has gone into the body, which is why it's actually a very preferred drug of choice when it comes to athletes. Many athletes have used it over the years. They've endorsed it over the years when they've had their sprains and fractures and, muscle pulls and things like that. They've always preferred during the Olympics to use homeopathy because they know that that's something that's going to give them, again, those quick results and avoid them taking any medications that could hamper their, progress in the Olympics.
Could you name some sports person?
Well, the famous two that I can name would be Usain Bolt. In fact, even in his documentary, he had, they had shown one of the times when the homeopath had visited him through the process and, helped him with his muscular pains. Yeah, and in fact, even David Beckham says that he regularly uses homeopathy because I think in UK, again, it's been quite a prominent treatment modality, including the royal families come out in the open and, said that we have our own homeopath, and it's been quite popular with the British.
So any sports person can take it if they want to.
Yes, definitely. Any sports person. There are homeopaths who specialize again in sports medicine as well. I know there are certain homeopaths who even travel around with certain teams in India and work with them. Yes, and work with them.
Oh, great.
Yeah.
So doctor, tell us, if parents want to raise healthy kids, what would be the first aid kit that you would curate for emergencies like fever and flu?
Okay, so I feel like if parents were to raise healthy kids, the first thing that they should be doing is erasing everything that they know about how to treat kids and start from fresh, because
Unlearn
you need
everything.
those fundamentals in place. If your fundamentals are not in place, unfortunately, you can have 1,001 kits at home. But if you are so nervous to use that and so nervous from not using conventional medicine, you will never be able to really work with your child.
Okay.
And so I feel like the first step is to understand what health is. For a lot of mothers, they feel like a healthy child is a child who doesn't fall sick. But that is completely wrong. A healthy child is a child who falls sick. A very, very unhealthy child never falls sick.
Okay.
So it's very important to get those infections every few months. It's very important for the immune system to be stimulated every few months. So in fact, all the way starting from 1989 was the hygiene hypothesis that came out in the British Medical Journal. And since then, there are multiple studies that have come out which show that kids who don't get sick are the ones who are prone to developing lifelong infections. The kids who don't get sick are the ones who develop more allergies. The kids who don't get sick have a higher chance of getting asthma.
Oh my God.
But parents don't know that. So they feel my child should not fall sick. My child should not get that fever.
Right.
And I feel like that's fundamental. That's fundamental for a mother to understand what is health in a child.
Right.
You know, a healthy child gets sick, but that same child should recover well. That same child should not get complications. That same child should not fall sick every month.
Right.
You know, but at the same time, the child should fall sick, you know, every few months. That is very, very important. So I feel like it all starts from there. Once mothers understand that, and that's the first consult that I have with them is after understanding, you know, everything they want to tell me.
Yeah.
I put across everything that I need to tell them. Because if you are not on the same page with me, it becomes very difficult for me to work with you. So you have to understand that. And then parents have a choice. You choose to, you know, medicate your child as much as you want to,
Right.
and you choose homeopathy as much as you want to. I cannot enforce that decision on you, but the confidence in me comes, right? So eventually over a point of
Yeah,
time, they
making
feel more confident.
Yes.
Like for example, this mother who had this, you know, child with the throat, now she knows, and she was surprised. She's like, you know, this is the first time I've not used Panadol on my child in the last 5 years of fever. And she was like, I was a little scared on the first day, but after that she's like, literally I was so impressed with the way it worked that confidence. So now I know that for her, that same child, her other two siblings,
Yes.
you know, this
sorted.
mother is going to now rely on homeopathy
Homeopathy.
for the day to day.
Very
And
true.
that only comes from knowledge, education, experience, working with the right person.
Right.
And then, of course, yes, all of them have this kit. There are remedies that are there in the kit for almost every complaint.
Okay.
So there's one kit that I have, which I call the travel kit.
Okay,
and so
yes.
that has your
That's
travel.
very-
Exactly. So your travel sickness, your jet lag, constipation, diarrhea,
Fever,
food poisoning,
yeah.
yes, fever, cold, cough. Everything is in the kit. The instructions are there that I give them along with it, so they know exactly what to do. They use it as the first line of treatment, you know, every time the child gets those symptoms. And then the second kit that I've designed is specifically for cold and cough.
Okay.
Because that's something that I have a lot of patients of. And so, again, as I said, since we have 2,000 to 3,000 remedies, we can use more than 100 to 150 for colds and coughs.
Right.
And so sometimes it becomes difficult for parents to have all of those. So I give the most important ones or the most regularly used ones. They keep it with them, and then that has the names of the remedies, and they can use, you know, based on what I prescribe to them.
Is it possible that you could name the medicine for flu or...
Oh, okay. So for flu, actually, the preventative that I like to use is a remedy called oscillococcinum.
Okay.
It's available actually in Europe. If you go to any of these pharmaceuticals, especially around Switzerland, Germany, you'll have it right at the checkout counter because
the
it's
counter.
that frequently used. Because, you know, through the winter months, you know, a lot of these flu cases that come up. And so I think a lot of Europeans would be very familiar with this oscillococcinum. And so I use it very often, again, as a preventative. So, you know, you're going to these cold climates,
Yes.
like you said, and things like that. It works very, very well. Arnica is a very common remedy that I use for
India.
bruises.
Yes, even I've used that for my son.
So for bruises and falls and, you know, any kind of injuries,
Yes.
which kids are again very
I
prone
didn't know
to.
it was homeopathy.
Yes.
Sorry, I didn't know about that.
Yes, so arnica came from homeopathies. Then echinacea is a remedy that I use very often for flus, colds, coughs, for throat infections, any kind of throat irritation, strep throat. It acts as a good palliative in those cases as well. And again, there are 101 others, you know, that I can name.
Yes.
But again, homeopathy
some
being
common
very
ones.
specific, you use them based on the symptoms. So when a child has cold and cough, and
Yes.
the cold and cough kit that I told you, the reason why parents have to message me for me to tell them what to give is because it's very specific.
In today's world, I think the biggest problem that we all are going through is anxiety, sleep disorder, or some behavioral problems
Correct.
that we all are going through, whether it's kid or an adult. how does homeopathy look at the mental and emotional well-being of that?
Okay, so again, as I said, homeopathy is one of the very few sciences that has the ability to work on mind and body.
Right.
Because we believe so much in the connection of the mind to bodily complaints. And again, this is a whole science that's now developing. It's called psychoneuroimmunology.
Okay.
So this science basically goes on to say how your psyche, which is your emotions, goes on to developing your nervous system and influencing your nervous system as well as your entire immune system. And they have done again a lot of studies on this where they produced certain emotional triggers in animals, and they saw, for example, they took away calves from their mother cow, and some of the calves they left with the mother cow. They studied their blood work, they studied their enzymes, and they saw that the calves that were taken away had significantly lower immune markers than the ones that were allowed to be with their mother, which shows that instantly that emotion of separatedness from the mother produced actual physiological changes in the body, which we did not know 200 years back when homeopathy started. So it was actually one of the first few to go and say that, okay, your mind does influence what's happening in your body, does influence your enzymes. Every organ that we have is representative of certain emotions. And this is not only homeopathy, this is also Ayurveda, this is also TCM, which will go on to tell you that there are certain emotions which go and affect certain parts. For example, the liver is an organ that we resonate with anger.
Right.
The kidneys is an organ that we resonate with fear.
Okay.
So emotions have affinities towards certain organs. And so when a patient comes to me, for example, with urticaria, okay? Now, urticaria, if you see the child, like urticaria is hives.
Okay.
So when you see, skin with urticaria, how is it? It's red, it's inflamed, right?
Yes.
It looks angry. The skin looks angry. This is generally a representation that there is some form of suppressed anger that's sitting in this person that this person has not been able to voice out. So the skin is voicing out for the body. And so in 99% of the cases, when you dig and dig and dig, you will see that this person is actually so angry about, something the mother-in-law said or something, that happened in the family that she kept to herself, could not voice out. And the skin has now come up with a representation like this. And so we see that time and time again where the mind does produce these physical effects. But coming back to your point of anxiety and, mental health issues which are happening now,
yes,
homeopathy has a great scope in working on them because we can work at the level of the mind. We can work on resolving these unresolved traumas. We can work on addressing these things in the system that the body is not able to really process. So, for example, let's say, I have a patient who comes to me for lichen planus, which is an autoimmune disease, but she also has massive depression and anxiety issues. It all starts from the fact that, the mother-in-law has been very dominating, been very, controlling of everything that she's done till now, and she still stays with them. So there's, that constant emotion of, having someone control you, say things to you, which you've not been able to say things back to. And when the right homeopathic remedy is given, this patient can now resolve a lot of the issues. Now with anxiety, we have a very nice bach flower remedy we use called rescue remedy, for example. I give it to a lot of kids who come to me because kids are suffering from massive anxiety these days because of social media, because of the pressure of exams, XYZ. And so just having a little bit of a rescue remedy, it's a flower extract. Okay. Very safe to have. You can have it how many ever times a day. Again, in Europe, you see it available in almost every pharmacy. You take a little bit of, 1 or 2 sprays in the mouth. Okay. And you feel so much calmer, so much better, instant relief. So when you, for example, talk about anxiety and depression, now there are a lot of studies which show that sometimes these are not related to what situation you have in life, but more to your gut. Okay. So gut dysbiosis or having the wrong kind of bacteria present in your body can produce these emotions in you. And so sometimes taking a good probiotic is all you need for treating the anxiety and depression.
How easy it should be.
But if you don't know that as a doctor, or if your physician doesn't know that and keeps giving you anti-anxiety and antidepressive, but the symptoms are, just ever the same because you haven't worked on what's causing it. Or for example, insomnia. Most of the times you need magnesium. Yeah. For example, a supplement as easy as magnesium, which is available in your Guardian and Watson, can help you drastically as compared to taking, medications like sleeping pills, which are very addictive in nature.
So doctor, in a layman's term, how can you explain immunity and health?
Okay, so I think I would probably use the help of a story to be able to explain that better. So the story starts with a farmer who had a huge piece of land, and it was a very thriving piece of land. Now, one fine day, the farmer notices that there's this little swamp that's formed in one part of his land. And that swamp is attracting a lot of mosquitoes and destroying his plants. So he waits for a day or two, and eventually he's like, I need to get rid, of these mosquitoes. They're destroying my farmland. He goes to the shop, he picks up this, mosquito repellent spray, he gets it to his farm and he sprays off the mosquitoes. And lo and behold, the mosquitoes have disappeared. And the farmer sleeps peacefully in his house, waking up the next day, only to find that now there are even bigger and more mosquitoes that have infested that same swamp. They're infesting his farm, they're destroying more and more plants now at a faster rate. And he's doing his spray, it's not working anymore on these mosquitoes. He goes back to the shop and he's like, I need something stronger, give me something stronger. And the shop is like, okay, you know what, I'm going to give you this spray. This is a much, stronger form of the mosquito repellent. Try this one. And so he goes back to his farm and he starts spraying that, And again, lo and behold, all of these big mosquitoes are now completely gone. He again goes to sleep, wakes up the next day, and he finds that now this time the mosquitoes have increased not only in size and number, but they're ferocious. They're attacking his farm in numbers. His field is almost completely destroyed. He doesn't know what to do anymore. This process goes on repeating for another time till finally the mosquitoes reach a point where they have eaten away his entire farmland and it's completely destroyed. And this farmer has to vacate the entire premises and it's all, a loss of his income for him. And so, similar to this analogy, if I were to ask you, what is it that this farmer, what should he have done to be able to actually save his farmland? And where did he go wrong?
He could have just removed the swamp.
Exactly.
From the start.
Exactly. That's all he had to do. All he had to do was clear up that swamp that was attracting those mosquitoes in the first place. But he was so focused on getting rid of the mosquitoes that he didn't realize why the mosquitoes were coming. And so this brings us back to the same concept of our health and immunity. What we're so focused now as mothers, as adults, is that we want to destroy that infection that we're seeing. We want to destroy that symptom that's coming up. But we're not really going into understanding why is the body throwing this symptom.
Right.
What is actually causing the body to develop this kind of a symptom. The minute we understand that and fix that root issue, clean up that swamp, clean up that deficiency that could be in our body, clean up the inflammation that could be there in our body, automatically you're having a much healthier farmland. Automatically you're not attracting any mosquitoes anymore. Automatically you're not attracting any diseases to your body anymore, because it all starts from within. And this goes actually to explain the whole concept of, understanding what is the terrain, which is your entire body system, which is what you need to keep clean to be able to have a good functioning immune system, to be able to then lead a healthier life.
Understood. Yes. Thank you, Doctor, for such a great talk. It was amazing and such an insightful talk about homeopathy. I wish everybody can adopt homeopathy for their kids or for themselves.
Thank you.
Thank you,
so
Doctor.
much for having me. It was a pleasure to share all of this, and I'm glad that you enjoyed it.
Yes, I have a small gift for you. Thank you. Thank you,
so
Doctor.
much.
Thank you, everyone, for being here and listening to our great talk.